So obviously ours is just a phase 2 study. So obviously I always like to make sure I say that it's just a phase 2 study, and you need a much larger, longer term follow up to actually make that comparison to tamoxifen or aromatase inhibitors. But CEBZA, I think, just to say what it is it's a combination of conjugated estrogens. So it's actually estrogen compounds that's also an FDA approved drug, which I won't mention, but it's an FDA approved drug that's made up of lots of different estrogen compounds that actually have different activity on the estrogen receptor. So some of those agents can act as SERMs, some of them are inhibitory, some of them are stimulatory, and then it's complex. So it's complex to Bazedoxifene, which is in the class of SERMs. So it's a third generation SERM. And how it differs from tamoxifen is, number one, it's much more selective. So it doesn't stimulate the endometrium. So that's the big difference between Bazedoxifene and tamoxifen, and that is why they kind of put this conjugated estrogens and the Bazedoxifene together. So they kind of took out the progesterone that used to be part of combination estrogen and progesterone therapy, and they exchanged it for the Bazedoxifene. So that's a easy way to think about it. It's a new class of drugs. It's actually called a TSEC. That's what it is the class of drugs. So it's different from aromatase inhibitors and SERMs, that it is a complex of estrogens and the Bazedoxifene.